the harm of an adult dependent as well. And so this form of abuse can put the child or dependent adult in serious danger of injury or death, and FDIA is a criminal offense. So remember that as we go through today, this can apply, most often it's applying to children, but it can be to dependent adults that are, for one reason or another, unable to kind of keep themselves safe due to being maybe elderly or having developmental disabilities. And so, as I mentioned things, I may just reference a dependent adult or a child, but know that it really is interchangeable. It's really anybody that struggles with or doesn't have the ability to protect themselves or keep themselves safe from the person with the disorder. So the signs and symptoms of factitious disorder imposed on another are going to be present both in the caregiver and in the child or adult victim. So in the caregiver who has the disorder, it's important to look for signs like deception. Right? They are lying about things, they're hiding things, they're reporting things differently than what is accurate. And what they're reporting is often different than what medical personnel have told them, and they may be sharing inaccurate information with one doctor, claiming it came from another. They oftentimes have medical knowledge and may even work in a medical setting. Often have the desire to be seen as good at what they do, so good as a caregiver. They're often seeking approval and attention from the medical staff. There's a refusal of the caregiver to leave the victim's side when they're being assessed, asked questions, treated. And then the victim's medical history is kind of spotty, it's vague, it's inconsistent when the caregiver is sharing it, whether through documentation or verbally. And then recommendations for invasive diagnostic and surgical procedures are accepted without question or concern. So the caregiver isn't questioning if this invasive or really serious procedure is needed, if it's warranted. Oftentimes, there's some excitement about it being that severe. And then in addition, the caregiver will often ask for a second opinion, further interventions, additional procedures. So they're asking for more care. Often present in the caregiver are poor relationships with their family, their friends, maybe an absence of relationships or other social networks. Then what are we looking for in the victim of all of this? So reported medical problems that seem to not respond to treatment. Symptoms or signs of illness that only appear in the caregiver's presence. Signs and symptoms may improve while under medical care. Oftentimes there's a history of multiple and repeated injuries, illnesses, medical procedures, surgeries, hospitalizations. Oftentimes there's a atypical presentation of the disorder. So they may have been diagnosed with something, but the symptoms and the testing and the observations aren't what we would typically see. Oftentimes, alluding to the fact that that might not be an accurate diagnosis. And commonly, the second parent is absent. So there are some commonly reported symptoms. So by the person that has FTIA, the symptoms that they're often reporting are present in the victim include nausea and vomiting, diarrhea, seizures, breathing difficulty or asthma, infections, allergic reactions, fevers of unknown origins. And so the caregiver may be lying. Another possibility is that they may be purposely taking action to cause these symptoms. So creating these situations, of course, can put the victim at a great risk. To fake symptoms of illness, they might do some extreme things like giving them certain medications or substances that'll make them throw up or have diarrhea. Heating up thermometers. So it looks like the person has a fever, not giving them enough to eat. So it looks like they can't gain weight. Adding blood to urine or stool, making up lab results. And so the caregiver often will falsify medical information, like reporting procedures that never took place or diagnoses that were never professionally given. And they knowingly will expose a victim to painful or risky medical procedures, even surgeries. And the people with FDIA are not discouraged by the cost of the medical treatments. They don't worry about how they'll manage the bills. Instead, they oftentimes believe driving up a large hospital bill reinforces the perception that they are doing everything that they possibly can for this victim. They think others will see them as better caretakers the more money that is spent. Now, much less commonly is FDIA imposed on a pet. And this, when we do see it, oftentimes is taking place when there is no access to a child or a dependent adult. And it can also happen alongside the abuse of a child or dependent adult. It's much more rare, but it can happen in pets. And typically, like I said, when there isn't access to a human to do this too. All right, so now let's talk about the diagnostic criteria. And so this is based on the DSM-5 TR. We kind of mentioned that a few slides ago. And this is the Diagnostic and Statistical Manual of Mental Disorders created by the American Psychiatric Association. And so the first manual came out in the 1950s. We're now at the 5th edition, the text revision, which came out in 2022. And in this, you'll find all the identified mental disorders, information about each of them, including diagnostic criteria. And with each edition, there's changes that are made. And so if we remember in 2013, the 5th edition came out, and that's when the name was changed from Munchausen syndrome by proxy to FDIA. So let's go over the diagnostic criteria. So this is a criteria that professionals are looking for someone to have to be able to receive a diagnosis. So first is the falsification of physical or psychological signs or symptoms, or an induction of injury or disease, and another associated with identified deception, right? So there's physical or psychological signs and symptoms. The person that has this disorder is either causing the injury or disease or lying about the symptoms. Next, the person presents another person, or in rare cases, pets, as ill, impaired, or injured. Either they're causing them to be ill or they're lying about there being the illness. This lying behavior is evident even in the absence of external rewards, right? So they're kind of like we mentioned, they're not doing this for some kind of monetary gain. I don't know, those TV shows that give new houses to people that are sick, right? That they're not doing it for those things. So they're not getting those types of things out of this. They're not trying to get rewards from it. And then, of course, it's not better explained by another mental disorder. And then there's specifiers. And so specifiers go along with diagnostic criteria and just can be kind of an extra piece to it. And so the specifiers for this disorder are either a single episode or reoccurrent episodes, so 2 or more events of falsifying illness or causing illness or injury. Oftentimes, it is reoccurrent. It's rare that someone gets caught kind of on that first episode of the disorder. All right, so we've talked a bit about the perpetrator, the person that has FDIA, but it's so important to talk about the child or dependent and how this disorder is inflicting abuse on them. Before we do that, I'm just going to answer a couple questions from this last section. Is FDIA illegal? Yes. So this is abuse. It's abusive behavior. So it's not illegal simply because you've been diagnosed with it, but the behavior acting on this is definitely illegal. Are they aware of what they're doing? And typically, yes, there is awareness of what's happening, that they're not being honest, and that they are causing harm to the victim. All right, so let's talk about the child or dependent and the abuse. So, really, one of the biggest concerns in cases of FDIA is the safety of this child or the dependent person. Ensuring their safety is important, and it's often involving kind of placing them in care of someone else once the abuse is discovered. And so, this can take place with a team of people to accomplish it. Sometimes we've got the hospital social workers and foster care organizations, law enforcement gets involved, and healthcare providers. And so once it's determined that the child or dependent is being abused, they need to be protected. And so this usually means contacting child protective services or adult protective services and removing the children or dependents from the care of the abuser. Any existing physical illness or injury needs to be treated. And so that usually is kind of a first step for the victim. And then, of course, psychological counseling is going to be necessary, since this entire process is very, very traumatic. Now, what are some of the complications to the victim? Well, factitious disorder imposed on another can lead to both serious short-term and long-term complications, including, right, if it's not caught, the continued abuse. But we're going to see things like multiple hospitalizations and a lot of unnecessary treatments. You know, surgeries that don't need to have happened, and so it could be changes in the body, amputations, removal of some organs, right? Like it can become a very, very serious thing, all the way to death of the victim. And so research is suggesting that the death rate for victims of FDIA is about 10%. In some cases, a child victim of FDIA learns to associate getting attention to being sick, and then develops a similar disorder called factitious disorder imposed on self. And so factitious disorder imposed on self, right? So today we're talking about factitious disorder imposed on another person. So this is the same thing, but we're imposing it on ourselves. Is a mental disorder where someone falsifies, exaggerates, induces physical, emotional, or cognitive disorders in themselves. And so this was previously known as Munchausen syndrome. People with factitious disorder imposed on self act this way because of an inner need to be seen as ill or injured. And it's not to achieve any kind of concrete benefit like medication seeking or financial gain. And this is distinguishable from the term malingering, which is where someone exaggerates or fakes an illness to, for example, get out of work or get disability. Right? It's different than that. We're not going for these gains. It's about being seen as sick or ill, and kind of the attention that is given because of that. And so the exact cause of this disorder is not known, but it's believed that a lot of psychological factors play a role in the development of this. One, right, being that they were the victim of factitious disorder imposed on another in their childhood, or just a history of abuse and neglect in childhood, or a history of frequent illnesses requiring hospitalization. And these are actual illnesses. So a child that grew up kind of ill, required a lot of medical treatment, legitimate, but may develop factitious disorder imposed on self because of the attention that was given while genuinely sick. All right, so next we're going to watch a video, probably the most well-known occurrence of factitious disorder imposed on another is Gypsy Rose Blanchard. When we first started talking about factitious disorder imposed on another, Gypsy was still in prison. And now she is out. So Gypsy mother Dee Dee falsely claimed that Gypsy was suffering from a variety of illnesses for about 20 years until Gypsy arranged for her boyfriend to kill her mother in 2015. And it was earlier this year that she got out of prison. So Gypsy's going to talk a bit about what the situation was like with her mother and some of the procedures and some of the diagnoses that she was given based on the information her mom provided and the illnesses her mom induced in her.
What illnesses did your mom say that you had?
Asthma, epilepsy, hearing impaired, vision impaired, fed with a feeding tube, paralyzed from the waist down, slow, so retardation, and among other things. I just can't remember them. I was on breathing medication for seizures, a medication to help go to the bathroom, pain medication, anxiety medication, just everything. I would have to put on the breathing machine every night. I hated it though because it seemed to make my breathing worse, not better. And then another machine was for the feeding tube. It was controlling what I'd eat. My medications would be put through there. I really wouldn't even have to be awake, so she could put whatever in my body and I wouldn't even know.
Make me a yard. So where are you going today?
I'm going to Children's Mercy Hospital to see my dentist for my teeth.
And we'll be back.
And we'll be back soon.
Not yet.
If we'd be going to the doctor, she would do all the talking. I'd always have a stuffed animal or a Barbie doll. She'd just tell me, just play with my Barbie doll. If the doctor would come to examine me, just stay in the wheelchair, be calm, play with your doll, and don't move your legs. I was just as much in the dark as everybody else. The only thing I knew is that I could walk. As for everything else, the leukemia, the epilepsy, I was taking medication that she said was cancer medicine. She would shave my head and say, well, it's gonna fall out anyway, so let's just keep it nice and neat. I just went on blind faith that a mother knows best.
Okay, so that just gives kind of a little glimpse into what the disorder can be like, what it's like for a victim and the effects of it. So next we'll talk about contributing factors. Before we do that, let me just check a few questions. So someone asked, is the dependent the child not sick? Right. Now, there may be times where there is some kind of sickness or illness and the person is making it worse, it's exaggerating it, but no, these are made up symptoms or induced symptoms. So for someone who's doing, who has factitious disorder imposed on self, are they aware that they're doing this? And yes, they are aware of it. So for FDIA, what is it that someone's getting out of this? And so a lot of it is special attention. And so being seen as, this wonderful caretaker, so giving of themselves, look how they're putting this person first, and they're putting their life on hold to care for this person, and getting all of this kind of special attention. How did she end up imprisoned, Gypsy, and for murder, right? There's lots of debates, especially since she's now out of prison, of whether that was fair or not. But right, it's illegal to murder someone, and so even when it may be considered or tried to be argued of defense, that can't happen, and so it is, it's unfortunate, right, to just kind of think of someone who was abused for so long, then having to go through the trauma of being imprisoned, but we don't need to go down the rabbit hole of all of that and opinions. Either way, what happened to her is terrible. I guess we can just leave it at that. Do people with FDIA ever feel bad about what they're doing? I would imagine there's probably people at some point that might. But maybe not always. They're getting something out of it. Is Gypsy living on her own? Yes. So there's actually, I think, reality shows following her now. She's been married. I think she's might be having a child now. I think that we can see definitely that there's the effects of the trauma that she's experienced and those kinds of things. But, for the most part, she is kind of living, what seems to be for her, well, the kind of life that she wants. All right, so let's talk about contributing factors. So we'll talk a bit about some statistics. So the average age of the affected individual at the time of diagnosis is 4 years old. So not of the perpetrator, not the person that has FDIA, the victim. So typically the victim is around 4 years old when it is determined that the caregiver is doing this. The average duration of from kind of the onset of someone abusing the dependent through a diagnosis or determining FDIA is happening is 22 months. So nearly 2 years this goes on before it's determined it's happening. And again, it's not always figured out. 2/3 of perpetrators, so the people that have FDIA, are women. And it's believed to affect less than 1% of the population. All right, so what causes this? We don't know the exact cause. Kind of like with all mental disorders, it's a variety of contributing factors. Now, one theory suggests that people with FDIA experience a history of neglect, physical, sexual, emotional abuse as a child. So there's that history of trauma within their life. They may also have another psychiatric disorder that is contributing to this, things like personality disorders, bipolar disorder, anxiety, depression. Other theories point to the loss of a parent at a young age or a major stressor at a young age. Some evidence suggests that major stress, like a marital problem, can trigger an FDIA episode. So it's not that it causes it, but we might have already had maybe some contributing factors before, and then a major stressor in adulthood kind of triggers the FDIA to come out, and start with the symptoms. And then some people with FDIA grew up in families in which being sick or injured was a way or the only way they ever received love or care. Now, there's things that increase our risk of developing FDIA, and that's childhood trauma, emotional, physical, sexual abuse, being seriously ill during childhood, loss of a loved one through death, illness, or abandonment, past experiences during a time of sickness and the attention it brought, poor sense of identity and self-esteem, personality disorders, depression, a desire to be associated with doctors or medical centers. And again, working in the healthcare field increases risk. All right, so we kind of touched on this already, but you guys are asking, right? Like, why do this? And so people with factitious disorder imposed on another really have an inner need for their child or dependent adult to be seen as ill or injured as a way to get their own kind of special attention. And so this isn't done to achieve kind of a tangible benefit like money or drug seeking, right? It's often done really in order to just gain the sympathy and attention that's given to people who are truly ill and then to their family members. And so this attention comes from healthcare and social care staff, extended family members, friends, neighbors, media. And so a person with FDIA uses the many hospitalizations as a way to kind of earn praise from others for their devotion to the victim, often using, the sick child or dependent adult as a means for developing a relationship with a doctor or another healthcare provider. So then how do we keep this from happening? The unfortunate thing is that when we don't know exact causes for things, it can be really hard to prevent it. And there's really not a way to predict who's going to develop FDIA. And so it's important to recognize, though, that if FDIA is suspected, there's ways to prevent things from escalating. So, if you yourself have FDIA symptoms, maybe you've never acted on it, seek out a mental health provider immediately before you hurt anybody. Now, if you think a child is being abused or a dependent adult is being abused, contact the police, call 911. You can also contact the Child Help National Child Abuse Hotline and get some guidance and help with that. Oftentimes people are like, oh, I'm not so sure. I don't know what's going on. I don't know if I want to report it. What if I'm wrong? And that's why there's these trained people there to make these decisions. You don't get in trouble for making a report that is genuine, even if you're incorrect. And so it's always better to just make the report and then let the experts decide what to do next. All right, so next we'll talk about diagnosis and treatment. Before we do that, let me check questions just from this last section. So how do we distinguish between people who are just kind of faking sick for attention versus FDIS? And a lot of it's going to be the severity, right? And in looking at the diagnostic criteria, I think it is common for not even to be faking sick, but maybe for people, children and adults, to maybe exaggerate when they're not feeling so great so they can be kind of cared for, babied, and it's not really hurting anybody. That is very different, right, than having this disorder and on a daily basis being deceiving about what it is that they're experiencing. And so a lot of it is the intention and what someone's getting out of it, right? Pretending your stomach hurts a little more than it does, so maybe your partner will, run to the store and get you something versus, completely lying about being sick so you can get attention from doctors, right? Very, very different. Who are we reporting this to? Call the police, call Child Protective Services, call 911, call Adult Protective Services to make these reports. So someone said, how does this happen? Like, how are these baby surgeries happening when the symptoms aren't there? And so it's going to be very dependent. Sometimes the symptoms are made up, it's a complete lie. Other times the person with FTIA is inducing these symptoms. And so the symptoms are present. And so it is scary, right, that this can happen. But it does, and the statistics on how often it's happening shows it's on the low side, but that doesn't mean that it's completely accurate because it can be going unnoticed. So who's going to typically diagnose someone with FTIA? And it's going to be a mental health professional, a psychiatrist, possibly a therapist will be making that diagnosis. Can people with FTIA stop on their own? Technically, yes, but very rarely does any mental disorder get better on its own, and typically without treatment, it gets worse. Can the victims learn these behaviors and continue? Yes, and so that's kind of why we talked about oftentimes victims or sometimes victims of FTIA then grow up to have factitious disorder imposed on self, or they may want to continue that special attention and have FTIA and impose it on their own dependent. Could other disorders contribute to this? And yes, we talked about personality disorders, depression, anxiety, and it can be, times where the disorder is very specific. So this person asked maybe like postpartum psychoses and those kinds of things. And I definitely don't want to attach this specifically to a postpartum time in life, but kind of what we talked about today, right, is that a stressful time, which could be postpartum, it could be marital problems, financial issues, a variety of things can be something that is triggering when the susceptibility of the disorder is already there. All right, so diagnosis and treatment. Now, people with FDA are obviously they're prone to dishonesty, so diagnosing can be pretty difficult. Additionally, with attention focused on the sick or injured child, it's easy for doctors and family members just kind of overlook the possibility of FTIA. Now, healthcare providers must rule out any possible physical illness as the cause of the child's symptoms. And this can be difficult to accomplish because it can be hard to prove that reported symptoms aren't happening, right? If you kind of think of the types of symptoms that we would report that a doctor wouldn't see, which is very common, right? Fever. They had a fever at home. We know how to treat a fever in a child. By the time I got them into the doctor's the next morning, the fever's gone. It could be the same with vomiting, diarrhea, those kinds of things. And that's very common for all of us to go to a doctor and report symptoms that we aren't having that very moment. And so that makes it harder. But providers often are going to use a variety of diagnostic tests and procedures before considering a diagnosis of FTIA in the adult caregiver. If a physical cause of the symptoms isn't found, then a thorough review of the child's medical history, as well as a review of family history, the caregiver's medical history, maybe looking also for factitious disorder imposed on self, might then provide some clues to suggest FTIA. If still not clear, the child or dependent may then be separated from the caregiver to see if the symptoms improve, so they no longer have access to them. And then often the person with FTIA may have other psychiatric disorders Things like borderline personality disorder and histrionic personality disorder are some of the more common ones. Now, then what does treatment look like? It's difficult to successfully treat people with FTIA because they often deny that there's a problem. Because treatment for factitious disorder in general is often difficult, there's really no standard therapies assigned to treat it. However, if approached in a gentle, non-judgmental way, a person with FDA may agree to be treated by a mental health professional. In the event that the parent or caregiver is willing to get help and they're not being investigated for or charged with abuse and going to prison, treatment often focuses on managing the condition rather than trying to cure it. And so the caregiver may face criminal charges related to the abuse that they've inflicted. So treatment for the caregiver/perpetrator is really going to depend on where they are with these legal issues surrounding the case. But therapy is what's going to possibly be helpful. And so the goal is to help the person identify the thoughts, feelings that are contributing to the behavior and to learn how to form relationships that aren't associated with being ill. And until the caregiver is ready to recognize the truth or admit to it, it can be pretty difficult for them to get better. The caregivers who acknowledge the illness falsification are more likely to benefit from therapy. And so treatment includes efforts to increase awareness and to reduce the risk of relapse. Indicators of successful treatment include the abusers admitting to the abuse, sharing specific details. The abuser experiences an appropriate emotional response to the harm that they caused the child. The abuser develops better coping skills and demonstrates the ability to refrain from illness falsification over a significant period of time. And so during these therapy sessions, the therapist helps the abuser identify the feelings that caused their behavior. Over time, they may be able to learn to change it. And they can learn to form healthy relationships that don't rely on someone being sick. Now, there's no medication specifically for the treatment of FTIA. Medications to treat kind of associated mental illnesses like depression or anxiety might be prescribed. And then in some severe cases, a stay in a psychiatric hospital might be necessary if the person's a danger to themselves or to others. And then lastly, we'll talk about coping. Before we do that, let me just answer a few more questions. Can the person that has FDIA recognize that they have a problem? Yes. It doesn't happen often, or they aren't openly or kind of readily admitting that there is a problem, but that's going to be kind of the most important piece to treatment, is that they are recognizing it, admitting to it, and showing, remorse for their behaviors. Does a person always know that they're lying? They're aware that these things aren't real. I would imagine that, let's talk, we'll take Gypsy Rose's case, right? That went on for 20 years. If you lie about something for 20 years, it may get to a point where some details are fuzzy and we don't know what is real and what's not. Yes, overarching, they know that these things are being made up, but right, there are, for Gypsy, she did have some genuine medical issues, and it may start to blur of which ones, Dee Dee was causing and which ones were genuine. There was a recent court case where someone was diagnosed with FTIA and then later that was changed. How does this happen? So misdiagnoses happen often when it comes to mental disorders. And oftentimes, right, we're talking about the diagnosis of this, and when someone with FTIA they, overall aren't readily coming forward and saying they have this disorder. A lot of the diagnosis is going to be made based on information from the dependent, their medical records and those kinds of things. While it is incredibly rare, there have been times where, and it doesn't even have to be FDIA specifically, but where a child's medical history starts to look like possible abuse. And sometimes it takes time for multiple experts to take a look and determine this. But misdiagnoses do happen. And so, yeah, it just makes it difficult. And this is a difficult disorder to diagnose kind of just in general. Is this part of a delusional disorder? And it's not, because for the most part, they're aware of what's going on. They know it's not accurate, and they're doing it anyway for the attention. All right, so let's talk about coping. When it comes to FDIA, it's most important that the children and the dependents are safe. That's going to be the number one goal. And so these coping skills can take place, once vulnerable parties are out of danger. That is always going to be number one before focusing on getting someone with FDIA the help that they need. We have to make sure everybody's out of danger. So of course, we want to be following the treatment plan, which is going to be made by a therapist, by a psychiatrist, whoever really your professionals are. And it's including things like attending your therapy appointments and taking medications as prescribed. If you're feeling the urge to cause an illness, talking honestly to your therapist or a professional to find better ways to cope with the feelings that you're having. And it can be helpful to remind yourself of the risks, reminding yourself that you could cause injury or even death each time you induce an illness or initiate a risky test or surgery needlessly. And it can be helpful to make connections. Many people with FDIA lack friendships and other relationships. They lack social support systems. And so we want to try to find someone that we're able to confide in, can share enjoyable times with, and offer their own support. All right, let me just check a few more questions. Someone asked if this is often seen in older adults. I'm not sure if you're talking about them being the person with the disorder or as the victim. Victim, yes. It's usually children, but it can be older adults. And we can see, in someone older doing this, especially if they've been doing it for an extended period of time. Something to consider, though, is more commonly we're seeing it in, being inflicted on children. Older adults don't always have the access to young children. Right, because they just grow up, but it isn't impossible, or an older adult could be inflicting it on an even older adult. Is there kind of a spectrum of severity? And there can be. I think with any mental disorder, we can see kind of the spectrum of less severe symptoms versus more severe. Now here's some recommended reading for you. We want some more information on this. It is quite an interesting disorder. I think there's a fair bit of misinformation in social media and media in general. We're kind of playing it up, sensationalizing it, but it can be helpful to learn more about it and really where those motivations come from. We'll make sure you get link for all of these in that email we send out tomorrow. I'll put links in the chat for you. And here are crisis resources. So if you or someone you know are in crisis, these are different numbers you can contact for help. All this will be in that email we send out tomorrow. We'll put links in the chat for you. And here are upcoming webinars. Just a reminder, this is the last one for the week because of the holiday, so I won't see you tomorrow. You'll be back here next week on Monday with Susan, Emotional Regulation in Kids, a Foundation to Manage Big Emotions. And lucky you get 5 webinars next week, including on Double Feature Wednesday, a new one, Psychology of People Pleasing. So we'll make sure to put the link to register for these in the email we send out tomorrow. Puts a link in the chat for you too. So take a look at our upcoming webinars. While you do that, I'm going to answer a few more questions. How do we tell family members about their behavior when showing possible signs of FDIA? So what I've kind of taken is like kind of confronting their behaviors. And I think, it can be difficult because if this is happening and you confront them, they may start to try to do a better job of hiding it. If you're not sure of kind of the outcome of what could happen, it may be that you're contacting authorities instead of being the one to talk about it. But I mean, it can be, starting to just ask more questions and in kind of more coming from a caring space. So not to alarm them, but just showing that you're paying a little bit more attention and wanting more details. But again, we don't want to, if you genuinely think this may be happening to a child in your life, we need to get the people there that can step in and start making some changes so we can keep them safe. Now, if you need any additional resources, head on over to our website, mindspringhealth.org, or you can find us on social media, Facebook, TikTok, and Instagram at Mindspring Info, or on LinkedIn at Mindspring Mental Health Alliance. You can also send us an email at info@mindspringhealth.org. And let's go over our frequently asked questions in case you missed it in the beginning. This has been recorded, and everyone who registered for today's webinar will receive an email tomorrow with a link to the recording in it. Also in that email will be all of the resources we talked about today. No slides will be sent out, and CEUs are not provided for community education webinars, but what we do provide are certificates of attendance once you've completed the post-webinar survey. So my goal is for everyone to leave here feeling like they learned something, and this survey lets me know if we reach that goal. The organizations that support our webinars want to know how their donations are used and what communities participate. The data is randomized, it's confidential, and no one's demographic information is shared. So everyone who registered for today's webinar and joined us during the live session will receive an email from certificates@mindspringhealth.org soon after the webinar ends. Complete the survey within 48 hours to receive your certificate. Now, even if you don't want a certificate of attendance, we'd love for you to complete the survey. Your participation helps us to continue to offer free webinars. Thanks for joining me twice today. Have a nice break, and I will see you next week. Bye.